Hello, let us now study about this model. This model is development of pharyngeal clefts and pouches, that means the ectodermal clefts and endodermal pouches. This is a model in the Department of Anatomy here. Now, what exactly is this model? These are the clefts. These are the clefts, first cleft, second cleft, third cleft, fourth cleft. And these are the pouches, endodermal pouches, first, second, third and fourth. In between whatever you are seeing, that one should be the arch. So this model need to be explained like this. The first ectodermal cleft here gives rise to mucous lining of external acoustic meatus as well as to the cuticular layer of the tympanic membrane. Rest of the clefts does not give anything because this second arch overgrows like this. You are seeing this brown color being overgrown, thereby covering these arches, these clefts here, thus forming a cavity which is called as this one, this green one, this is called as cervical sinus. With the formation of or with the growth of this second arch, now the contour of the neck of the fetus becomes smooth. And later this cervical sinus should obliterate. Failure of obliteration of this sinus results in cyst, that is a branchial cyst, usually found between the angle of the mandible and anterior border of sternocleidomastoid muscle, which may not be seen initially. As age advances, it may be noticed. And this cyst, when it is open onto the surface, it forms fistula, that is branchial or branchial fistula. Usually external fistulas are common. Sometimes that it may communicate interiorly with the pharynx also, where we call it as internal fistula. So this is all about the clefts. Now coming to the pouches, the dorsal wing of the first pouch joins with the dorsal wing of the second pouch to form this recess, which is called as tubotympanic recess. Dorsal wing of first pouch joins with the dorsal wing of second pouch to form tubotympanic recess. This recess gives rise to the tubo means auditory tube, the tympanic means the tympanic cavity. So it gives rise to auditory tube, the mucous lining of the tympanic cavity, the mucous layer of the tympanic membrane, the mastoid antrum and the mastoid air cells. Now coming to this second pouch, the dorsal wing, the dorsal part of it is joining with the first to form tubotympanic recess, but the ventral part, this one, it gives rise to the development of the palatine tonsil. So the ventral aspect palatine tonsil, dorsal aspect tubotympanic recess. Third one, it gives rise to, dorsally it gives rise to this inferior parathyroid gland. This is inferior parathyroid or 3, and the ventrally it gives rise to the thymus. This thymic element or this thymus joins with the fellow of its opposite side and fuses with the aortic sac. So with the gradual descent of the heart and the sac, this thymus also is dragged down along with the inferior parathyroid gland downwards. Now coming to this one, this is a fourth pouch. Dorsally it gives rise to superior parathyroid, and ventrally it forms a complex along with the rudimentary fifth pouch here to form ultimobranchial body, to form the caudal pharyngeal complex, which consists of thymic element, thyroid element and ultimobranchial body. Thymic element adds some components to the developing thymus. Once the thymus starts descending, when it reaches here, it adds something to it along its cortical aspect. Thyroid rudiment fuses with the developing thyroid gland. Once the thyroglossal duct descends till this region and it starts proliferating into lobes, it fuses with that and prevents the further descent of the thyroid gland, and ultimobranchial body gives rise to the parafollicular cells. So this is all about this model, which is nothing but the ectodermal clefts and endodermal pouches. Thank you.